So to undertake self-collection in your practice, I would recommend having a couple of things at hand. Firstly, you're going to need the sampling device, and the sampling device is effectively a dry swab. However, it is a dry flocked swab. What that means is the end of the swab actually has been developed in such a way that the surface area of the swab is increased and it will pick up extra DNA material, and that's what we're interested in testing. So most GPs have dry swabs in their practices. We'd recommend that you check that it is a flocked dry swab, and you can do that simply by looking at the label on the tube. And you're looking for the word FLOQ, which is flock, or flocked, FLOCKED. And that's because this is really the only sampling device that has been validated for use for processing self-collected samples. So when you're talking to a woman about how to take the sample, we do recommend, of course, you do that in a culturally appropriate and sensitive way. Many women who are eligible for self-collection are vulnerable women. We recommend that you point out the soft tip and explain to women that taking the sample should not hurt. It also helps to point out the red mark on the stem of the swab, which actually is the point to which women should be inserting the swab. So we don't want women inserting the swab into the vagina beyond that red mark. Having a visual guide at hand to show women how to take the swab would also be very helpful. And at the end, remembering to tell women that they insert the swab and rotate 1 to 3 times, withdraw and return the swab back to the tube. And this swab needs to be handed back to the nurse or to the practitioner. Remember to tell women if they have any questions, they should ask either the doctor or nurse about taking the vaginal sample, and also importantly to provide a private area for the woman to prepare for and to take the sample. You should also have a request form at hand, and it is perfectly fine to actually request a cervical screening test. In fact, that is what is recommended if you are sending in a self-collected sample. Either tick CST or request CST, or write out in full cervical screening test.